And let's get more now. We are joined by Uwe Janssens, President of the German Interdisciplinary Association of Critical Care and Emergency Medicine. Welcome to the program, and thank you for joining us. There are reports that we have heard that the president's oxygen levels dropped twice. What does that tell you about his condition?
Yes, from the far distance, it only tells that the capacity of the president's lung was perhaps affected by the virus disease, by the COVID-19. It could also tell that he had a high-grade fever on Friday, as reported, and together with high-grade fever and possible affection of the lungs, it could be that the oxygen saturation goes down, and that there's a very important measure to look after patients with COVID-19. So I think this measurement of oxygen, dropping oxygen level, led the doctors to change their treatments, and they should change their treatments.
So we know that he's tested positive for COVID-19. How long should somebody with COVID-19 be in the hospital or in quarantine so that they don't infect others? Because we've seen the president leaving the hospital briefly to greet his supporters. What do you make of that?
I think that, as the American physician said, I think that is not quite responsible. I think it's quite irresponsible to send out a message like that. On the other hand, the question regarding the quarantine of the President Trump is he started with symptoms and he was positive on Friday, I think. So at least he should be 14 days in quarantine. And that means that he should stay alone, that any contact should be very closely measured, and that there are measures taken to prevent infection. I think the sign to see him in a car driving through the streets, I think that's quite irresponsible. I think he shouldn't do that, and the doctors should tell him that's not a good idea.
And we have heard from the doctors at Walter Reed, the medical center. They have indeed criticized the U.S. president for that behavior. How much of an influence does a medical team have on such behavior of patients?
I think that's a political question. From the point of view of doctors, when they recommend something for a patient and they say, don't do that, and the patient is the one who is responsible for his actions. So I would tell a patient, don't do that. And then the patient said, no, I will do that. And he leaves the hospitals and go on the street. I think I would say, okay, he is responsible for his own behavior, and I told him not to do that. And I think that's the way to deal with patients' autonomy. And the President Trump has his own autonomy, and he acts political and not responsible regarding his health and the health of others.
Professor Uwe Janssens, President of the German Interdisciplinary Association of Critical Care and Emergency Medicine, thank you for taking the time to speak with us.
Thank you.